Let's talk about sex. Okay, so guys, sex is very taboo, but it shouldn't be. Here at Midtown, we have a lot of modalities that we can manage any kind of symptoms that have to do with sexual health. Sexual health is very important in a relationship, or even just as an individual as a whole. When we talk to women in general, we have vaginal dryness, we have vaginal atrophy, pain with intercourse. So when we have pain with intercourse, we associate that pain with sex, and so like sometimes, like let's say if you're postmenopause, a little dry down there, and your spouse is like tapping on your shoulder and you're like cringing, and these are all stories I've heard from patients. You're just cringing at the thought of sex because it just hurts, but we do have a solution for that. So when we can assess your hormones, look at your estrogen, look at your testosterone, we are getting to the root cause of what's going on down there. And in addition to that, we're treating like motivation, your libido, giving you the desire to have sex again. And it's so important in a relationship, and what we're finding out is that, this sexual health, the problem of it isn't just happening to postmenopause women, but it's in that perimenopause era. They're actually, they're starting to do some more research on the women that are in their 30s and in their early 40s, because it really affects a long, about 30-year span of women. And it can be treatable. We have a couple of modalities. We have the Votiva. It uses radio frequency, and we, tighten the tissue in the vaginal wall, helps with incontinence, helps with lubrication. We also have what we call our Pretty Kitty, and it's using like a lubricant that also helps, increase oxygen and blood flow to that area. Now for our men, there are also modalities. A lot of men, even in their 30s, just like women, we're seeing low testosterone. And that has to do with our environment. There's really, unfortunately, nothing that we can do about it except for identifying like what is going on. So here at Midtown, we're identifying, is it primary hypogonadism? Is it secondary? How can we treat it? And then also in addition to men, like there are also additional modalities besides just testosterone that we can treat, your sexual dysfunction. And again, that's, when we hear the word dysfunction, it hurts our heart, and I want patients to feel like that shouldn't be the case because it can be managed. And here again at Midtown, our goal is to work with you to get to a plan of care, so then you can live life, you can, enjoy your partner again. So again, hopefully you could choose Midtown and we can, go in this journey with you to, getting back your sexual health.